Okay, so my explanation of the TRIP components. Um, First is injury surveillance. So, what are the injuries that we're looking at preventing? Second is establish the etiology and the mechanism of injury. So, what MOI are most present? And again, what are we looking to prevent? Next, develop preventative measures. So, create prevention plans for the injury criteria. Scientific evaluation. So we're looking at, will these preventative measures be effective or receptive of them? Describe intervention strategies to inform implementation strategies. So how will we implement our prevention plan? And last, you're going to evaluate the effectiveness of implementation. So was this method effective, and how else could we have gone about it? So to compare and contrast, so the Van McKellen injury prevention model was 1, to establish extent of the problem, 2, to establish the MOI, 3, to introduce preventive measures, and 4, to assess the effectiveness. So my thoughts are both overall are looking for the same end result and are pursued generally in the same way. However, TRIP has more assessment and evaluation steps involved. So personally, the TRIP is more scientific. With assessment and evaluation involved, they'll be able to look back and have more feedback available to them and figure out exactly what may have fallen through the cracks or what they can improve upon in the future. Reflection of TRIP in clinical practice. So I do use a lot of injury prevention overall at my current job. However, something that this has helped me to realize I've not done a great amount of is reassessment and updates. So this is a goal for me in the future to reevaluate. So like, for example, there is a preventative measure. We have a stretching program that hasn't, when I came into this new position, it hadn't been updated for 8 years. So I went in head first and kind of updated these stretches and went around and demonstrated and showed them these. So this is something that my first initial thought going over this is I need to reassess and figure out, was this acceptable, was it effective, and just overall, did it work? The main strength is figuring out and implementing the best possible prevention plan based upon the injuries that are most common, things like that. A limitation could be collecting all the data of what worked and what didn't.